Are you living with a chronic injury? Do you have any idea how it happened? I know, they kind of just sneak up on you, right? Well, believe it or not, there's an actual process to it. Keep watching to find out. Hi everyone, my name is Nanadra Deanna, and I am dedicated to performers and athletes looking to improve their health goals and get the best out of life. Today, we're talking about injury. Specifically, how an acute injury becomes chronic. But how do we become injured in the first place? Usually, it's because of either trauma to a certain part of your anatomy, like a joint or muscle or something like that, or it's because of chronic overuse, leading to degeneration, inflammation, and just overall general weakness. In dancers and performers, the most common injuries we see are ankle sprains, knee torsion, hip impingements, and really just generally anything that affects the lower body because we use that so much. And yes, commonly they're overuse injuries. For an acute injury like an ankle sprain, that one was more so trauma. You rolled your ankle, it busted up the ligament a little bit, you got a little bit of bruising, or it's just generally painful and hard to walk on. For those types of injuries, it's a little bit more obvious to figure out what to do to make you feel better. Ideally, you're off your foot for a little while, you're icing it, keeping it elevated, and keeping it protected. After a day or two, you get to start to walk on it again, doing a couple of exercises, and you're back to normal within maybe like a week or a week and a half. Ideally, that's the process you're using for all injuries you get, but some of them are a lot harder to realize you have than others. For instance, the chronic overuse injuries. The issue with those ones is that you're using them so repetitively that you're actually just implementing little micro traumas, and without proper rest time in between, it just starts to impact and load on. What should happen is giving yourself ample rest time between workouts and classes to give your body enough time to properly rest and restore and bring yourself back to proper functioning. What really happens is we don't notice it at all. It's unfortunate to say, but we don't really tend to notice our pain cues. And frankly, dancers themselves have a very high pain tolerance. So, what might be a signal of pain to someone else might not even be noticed at all in someone who is constantly using their body and running on adrenaline more than half the time. This population also lives in a world of no pain, no gain, or fear of missing out on practices and falling behind. They're also living in a culture that's just telling them to tough it out. And they really don't have enough healthcare providers that really understand their type of training to give them an effective treatment plan. All that to say is we give ourselves really minimal recovery time when dealing with an injury. Maybe some ice after practice, some meds to deal with the pain, and that's basically it. So now we're training and taking classes on a semi-recovered injury. And like I said before, most of them are lower body injuries, so now our body weight is carrying an extra weight on weaker joints. This ends up leading to compensations. Whether we realize it or not, we start to favor the side that's less injured because we don't want to put as much weight on something that's not fully healed. So now we're on our other side, but then that side gets overtired or extra tight because we're not being balanced. Or you're changing your positions so you're causing yourself a little bit less pain. But at the same time, that's not the most biomechanical or effective position, which ends up leading to more pain, more compensation, and it just cycles like that. Working out and putting more stress on those joints that are only semi-recovered just adds to that inflammatory process, leading to more and more injuries, and it just piles on. And our bodies want to protect themselves, so they do everything in their power to make sure that they're staying safe. And internally, you're building up scar tissue around those joints to protect them further. But scar tissue isn't as pliable as our regular muscles or joints, and so you get stiffness. You think it's because you're cold, so you warm up more and you're exercising more, and you're just adding to the process of injuring yourself further. As dancers and performers, we are all too familiar with this process, and our seasons don't tend to stop to give us that time to rest. So it's on us to recognize when we're in pain and when we have those cues to give us that proper time to recover so that we can come back at full force. Because although it might not be a big deal right now and you only feel a little bit of pain, if you keep going down this road, you will feel it. Maybe it'll start one day after class, or maybe every day after class, or in class. Let's not let that happen. Thank you so much for watching this video. Stay tuned for part 2 when I talk about tips and tricks on how to manage chronic injuries and how to prevent them from happening at all. Be sure to like and subscribe to my channel, and I will see you next time. Bye.